mic. The House Appropriations Subcommittee on Human Services will come to order. Clerk, will you please take the roll?
Chair Roth.
Here.
Vice Chair Kelly.
Here.
Representative Mueller. Representative Beeson.
Here.
Representative DeSanta.
Here.
Vice Chair Edwards.
Here.
Representative Longjohn.
Here.
Mr. Chair, you have a quorum.
Thank you, Madam Clerk. Representative Beeson approves the minutes of May 20th. Be no objections, and the minutes are approved. All right, and Representative Mueller is here now, so we got a full slate. Appreciate it, everybody. Thanks for making it. Today, we're going to have a conversation and presentation on water affordability. I think we're going to bring up Dayna Roth. Dayna here. And we're going to have, come on up, and we're going to have Sarah Rubino give a presentation online. I think we're going to do you two first. They can make sense, so we can have a little more understanding what we're doing here. So if we can get Sarah online.
Hi,
Sarah?
yes, good afternoon.
Oh, I hear a voice. Okay, you're there, Sarah?
Yes, I am.
Good. Okay. Either one of you want to start?
I'll
Feel
start
free.
us off, yeah.
There we go. Thank you.
Hey everyone, Maggie Pallone. I am one of the owners of Public Sector Consultants. We are a nonpartisan research and consulting firm based in Lansing and Detroit. And we were asked in for the last decade, PSC has been heavily involved in water infrastructure and water affordability conversations, trying to help folks just understand the state of Michigan's infrastructure, especially our underground infrastructure, and the cost to repair and maintain those. And so I thought it'd be helpful today to just do a little bit of ground setting, and then others can obviously talk about the actual requests that they have in front of you today. So again, Maggie Pallone, not Dayna Roth. She is the one that did all of the data on this work that PSC did. So I thought maybe it'd be helpful just to just give us some grounding information around the history of water assistance in Michigan. And I think it's important to understand that there is no permanent program at the federal level that supports water assistance. Unlike energy, telecom, you even think about there is a program for low-income individuals to get a cell phone. But there is not the equivalent of that as you think about the water space. And so in Michigan, there is a significant need that doesn't know zip code, and some of the data that I've shared with you and we'll talk about today recognizes that this is both an issue in every corner of Michigan and also an issue for families of all sizes and of all ages. You have, though, been quite generous over the last few years in providing one-time assistance in this space, and so in 2020, during the height of the COVID pandemic, $25 million was given, and that helped 317,000 households pay down back water bills and keep their water on. In 2024, another $60 million was given, and then in 2025, another $10 million. There's also been legislation introduced that would create the first in the nation statewide water assistance program that would provide assistance to low-income households in Michigan, similar to if you're familiar with the MEEP or LIHEAP program that exists in the energy space already. I think that's all I want to say. Just, I guess, notably, there is a program in Southeast Michigan, RAP, that many people are familiar with. But in other parts of the state, there's challenges with implementing a program at the local level, so this really does need to be a state-led solution in some ways. So I said PSC was hired to do some of this work. In 2023, we were funded with generous support from the Mott Foundation to do this research. And we were asked to look at municipal water rates, household income, and affordability measures at the community level, and then try to understand the intersection of those two to understand what a statewide program could be and what the need would be if one were created. When we collected water rates, it was the first time in over 30 years that water rates across the states were actually collected, and we were able to collect water rates from 500 of the 1,200 water utilities in the state, covering about 85% of the population, though, with those 500 water utilities. I won't go into our methodology, mostly because I'm not a data scientist, and two, I don't think you guys care to have that level of detail. But I will say that we were able to use census data at like a micro region, and so the census has different regions that you can look at to determine how to break down the data, and we tried to break it down to the smallest data set possible. And then we looked at the cost and the number of households to determine how water was affordable. Again, just some base setting for all of us. I'm going to throw out numbers, and if you're not familiar with what the census shows, they might not be helpful. So 4.1 million households in Michigan. The average household size is like 2.43 people. And of those 4.1 million households, 1.2 million are under 200% of the federal poverty level, which is about $47,000 in change for a household of 2.43 people. Again, the larger your household, the larger what that number would become. The median household income, though, in Michigan is $71,000, and the average monthly water bill is $84, but again, highly variable depending on where you live, the number of people in your home, the condition of your home, the condition of your water utility system in terms of the cost that the water utility needs to pass on to a household in their rates. So like where I live, we pay actually a fixed fee for our sewer and a variable rate for our water, but in some communities, those both can be fixed cost. In some communities, both of those can be variable cost. So as we look at the statewide program estimates, again, a lot of this work was done as Senator Chang and her colleagues in the Senate and House were looking at creating a water affordability program. These were the numbers that we came up with. There's about 371,000 households that would qualify for a program that looked at having no household pay more than 3% of their total household income towards water. And that number is really reduced down for a couple of reasons from the 1.2 million households you saw that have under 200% of the FPL. The first one is because about half of those households don't pay for water. They either are on a well or their water is included in their rent bill. And so it screens out all of those households. And then there's obviously a large portion where even if they're low income, their water bills might be under 2% of their household income, either because of water use and consumption or just because they live in a community that has really low water bills. So 371,000 approximately, with an average annual gap between their water bill and affordable water of $435. That's about $36 a month that would need to be filled to go from having unaffordable water to what's considered affordable at no more than 3% or 2%, depending on their income level, deemed affordable. So I've broken down the data two ways for this committee today, but I will say that we've broken it down 1,000 different ways, and you can see a lot more of that data either in one-pagers that PSC created last year for most regions of the state, or on our website. There's a whole Tableau database that you can play around with and look at different ways to analyze the data. But the first way that I thought it would be helpful to break it down is to look at the regions that have the highest annual gap. So this is showing communities with the highest water bills compared to household incomes. And you can see that it ranges across the state. So Northeast Wayne County, Southeast Macomb County, but then Ingham County, the whole county is in the top 10. Including even, you can see Macomb, Western UP, the list goes on, but the communities that have the highest have an average annual gap of around 685, and even as we stay just in the top 10 and look at South and East Ingham County, the average annual gap is 517. This is broken down by, I want to say, like 150 regions if you look at the full data set, and I can share that with this committee after a committee today. The other way that I thought was interesting to look at was just the regions with the largest number of qualified households. A caveat that obviously Western UP is a much larger landmass than just looking at just Dearborn and Dearborn Heights, but it is trying to at least create some sense of the regions that the census can give us accurate data for. So again, regions with the largest number of qualified households. Western UP has the total most number at over 15,000 and has that gap of about 461. And again, what I think is interesting about this data, and maybe just a bias that I had going into this work, is that I have done a lot of work in Southeast Michigan and assumed that this was a Southeast Michigan problem. And as the data was pulled, right, this is across the state, every zip code in the state has need and has high levels of need. Even if I was looking at the slide before, you can see that Birmingham, right, a community that we all would say is a pretty wealthy community in our state, has a large number of households that actually would qualify for the program. And so really it is a program and a need that exists across the state and in all areas of the state. So like I said, our website has a lot more information where you can break this and splice this data down 1,000 different ways. But I hope today, at least what I was able to provide you, is just like a baseline understanding of why folks have been so passionate in their request around this issue, and why you're hearing from people across the state on the needs for a program like this to exist in Michigan, or at least some sort of assistance, because as I said, it's not a program that the federal government at this time can come in and help support. And I think Sarah's going to talk a little bit more about the ask, so I don't know if you want me to stop sharing or if that's something.
Let's get Sarah, and then we'll keep you guys here for questions.
Great, thanks.
Thank you. Thank you very much. I appreciate the opportunity to speak with you today. Again, my name's Sarah Rubino. I'm speaking on behalf of the Michigan section of the American Water Works Association, which represents approximately 2,300 water professionals across the state. So the Michigan section includes members from water utilities and suppliers of all sizes, in addition to municipalities, engineers, operators, utility leaders, scientists, and many others who are dedicated to protecting public health through the delivery of safe and reliable drinking water. So our members are really on the front lines of maintaining critical water infrastructure, as well as managing the water system costs. In our industry, we care about water, we care about our customers, and our vision is a better Michigan through better water. But Michigan communities are facing a difficult reality. The cost of providing safe and reliable drinking water is rising. And as Maggie mentioned, the ability of many households to pay is just simply not keeping pace. So water systems are working hard to modernize aging infrastructure, much of which is over 100 years old, and also need to meet evolving regulatory requirements that are in place to protect the quality of the water that we drink. But these come at a cost. So local water systems are supported by local customer rates. And I really want to stress that point because local water systems, again, are supported by the service fees and rates that they charge to customers. They don't receive county, state, or federal dollars, little to none. This means that when rates increase, even a modest increase, families on fixed or limited incomes, like our senior populations, will shoulder the burden with all other customers, and those households with lower fixed incomes can quickly fall behind. And those unpaid bills don't just impact the individual households, they impact the entire water system. When even a small portion of customers miss payments, utility revenue declines and tough decisions have to be made. Raise rates for everyone to recoup the costs, reduce the level of service to all customers, or defer needed capital work. And when rates are kept artificially low to control customer affordability, the problem just gets worse. Repairs are postponed, improvements are delayed, and corners get cut. And that's when all too familiar disasters can occur. Assistance programs are not the silver bullet to solving this problem, but they're a really important tool that support communities and empower them to set rates that reflect the true cost of service that's needed to safely maintain systems. Funding for water assistance programs is really good business. They prevent service interruptions that compromise hygiene and public health. They reduce administrative and shut-off costs for utilities. They avoid shifting unpaid costs to other customers. They stabilize revenue, which supports long-term system maintenance, as well as reliability. They also help improve public trust in our systems. A long-term solution to establish a permanent statewide affordability program with a sustainable funding mechanism has been proposed in a Senate legislative bill package. And I understand that those bills will be discussed later in this meeting, but I do want to share that the Michigan section helped craft and fully supports that statewide water affordability bill package. It's a fiscally responsible and common sense approach that provides a bridge between household affordability and water system sustainability. Safe water service is just as essential to life and public health as electricity or gas. I would argue more or less support than private electric and energy utilities. For decades, Michigan has invested in programs that help stabilize energy service for residents. Contrast that with water service. Water shutoffs are treated as local issues despite their direct impact on public health. Public water systems are non-for-profit. They have limited flexibility to spread unpaid costs without impacting service or infrastructure investment. And as Maggie mentioned, there's no permanent federal or state-supported water system fund. That means that utilities have to absorb losses and shift costs onto other customers. Still, public water systems, unlike energy providers, rarely experience outages, blackouts, or emergency shutdowns. They're highly reliable, locally managed, and operate under tight financial constraints. Until a permanent statewide solution is established, we're respectfully requesting that the subcommittee include $60 million in the fiscal year 2026 Health and Human Services budget to support water assistance programs across the state. Michigan's water utilities are committed to delivering safe, affordable water to every customer every day. We are local governments providing a public service for people, not profits. We're asking the state to be a partner in this mission by supporting programs that protect both public health and the financial integrity of essential infrastructure. Thank you very much for your consideration.
Thank you, ladies, and we do have a few questions, and then we'll bring up others to talk also. Representative Dayna.
Thank you for coming today. Thank you, Mr. Chair. I find it quite ironic that representing 21% of the world's surface water, that water would be unaffordable in Michigan. A couple of questions. One question, do we know the percentage of renters versus homeowners of the 371,000 households?
I'm not sure that we do, but we can try to see if we can break that down, and if we can, I can share that with the committee.
Okay, thank you.
Vice Chair Edwards.
Thank you. I have two questions. Is that okay? One is just a clarifying question. In your presentation in the slideshow, it said $84 is the average monthly total for water bill. Does that include the sewer, the taxes, the fees? Is it included in this? Because I don't know anyone with an $84 water bill every month. So I'm just wondering, are you like including everything else, or is it just the water portion? Because my apartment isn't even $84, so.
Yeah, thanks for that question, Representative. I think that speaks to the highly variable nature of water bills, because that is the average, including water, sewer, and any other fees associated with a water bill. So we saw bills that range, or communities that charge as low as $11 and up to some that average monthly bill was up in the $200 or more range.
Okay. My other question is, what happens if there is not enough money appropriated for the water assistance programs?
Yes, I can't speak to that. It's a program that MDHHS has run over the last few years, and I'm not sure how the allocation happens. Sarah, I'm not sure if you're familiar with how the funds are allocated that has been allocated the last few years. Oh, but sounds like somebody else is going to come up and answer that question for you after we're done.
Okay. Thank you.
You're welcome.
Representative Longjohn.
Thank you, Chair. I agree with Representative Dayna. It's shocking that Michigan's in this situation as a Great Lakes state. Could you have any information about how other states who aren't the Great Lakes state, I know there's no federal program, but are there natural advantages or disadvantages to being the Great Lakes state when it comes to this, or is that 3% number that's the benchmark kind of based on only our understanding of what rates might be that fit into a budget? Not saying that's the right number. I'm just curious, is that kind of a conventional wisdom? People say don't spend more than 30% on housing. Where's the 3% number come from? And is that informed by work in other states?
Yeah, great question. Thank you, Representative. So that 3% number is a number that's been established by EPA to define what an affordable amount is based on other household income expenses. And so that number is a number that's used across the nation in talking about an affordable rate for water. It's how we get to a spot where we are the Great Lakes state, right? 20% of the world's fresh water, like 40% of the world's fresh drinking water, all within our boundaries. It's a convoluted, long history of how federal funding has come through to the states to fund infrastructure. And so before the 80s, as you can imagine, when we were building infrastructure out across the nation, the federal government provided most of that money in terms of grants. And so most of the infrastructure that's been built in our state was built before really the 1980, and a lot of what you can still find was built even before the 1940s. And so I know they're still pulling up wooden pipes in communities as they're going around pulling up pipes across the state. And after that, though, we have now been operating in a system. Instead of getting grants from the federal government, we're getting loans from the federal government. And so communities just can't afford to take on the cost. And so water rates are rising not only in Michigan, but across the country. So I think what you're seeing in Michigan is no different than what you're seeing in other states. Our underinvestment in our water infrastructure is around $3 billion a year. And if you look at data that's been put out by the U.S. Society of Civil Engineers, that's pretty much across the board. There's no state that's earning an A or even a B in terms of their water infrastructure cost, and that's just raising the cost to everyone. And so that's it. And then Michigan is just a lower income state. And so you combine higher water rates, no different than other states, but with lower incomes, and that's where you get that divide.
Thank you. A follow-up, if I may, Mr. Chair. So, knowing that the story you just told from 1980s to today, a chronic underinvestment in infrastructure that's now leading to a doubling of rates, whether it's PFAS or other things that have popped up, I'm hearing in my community, that folks are expecting the infrastructure costs that are needed to keep people safe and healthy, free from carcinogen risks, is going to potentially double water rates again in the next decade. Is that a trend that you're seeing across the state? Are we seeing not just the doubling from 1980 to today as a data point, but modeling or expectations that trend will continue or even exponentially increase?
I'm going to ask Sarah to answer that from an AWWA perspective.
Yes, thank you, Maggie. I do believe that it is a trend that we will expect to increase, although I don't have the data or the stats on exactly how much. But obviously, regulatory requirements that are in place to ensure that the water that we receive is clean and safe to drink. And so, making sure there's that source water protection and that you are delivering clean water, there's a cost to that. And obviously water utilities, can't control the pollution that goes into our water, but we're responsible for treating it and making sure that it's clean. And so there is an increased cost in that.
I guess I've got a couple little questions. Well, Traverse City being one of those areas that just hit a wood pipe when they were doing some road construction, and they found a dead-ended pipe, which having stagnant water is not a good idea, and some not investment, obviously, in some of our water systems, not having a maintenance fund, that kind of thing. There's lots of things going on. Can you give us a little bit of the policy part of it? I mean, that's not exactly what we do, but I understand hearing from last term some of the thoughts and the bills that were being out there. are there any major changes, anything different that you guys can share? If not, we have others folks coming up, so I don't want to take anybody's thunder, but if you can help us with that, that
Yeah,
would be good.
I'm going to defer to others. PSC only does the policy side, so I'd love to talk to you about the policy, but don't do the politics. So I can't speak to actually what's within those Senate bills.
Yeah, no worries.
Yeah.
If maybe somebody else.
But if you want me to bore you on more history of the fund infrastructure conditions, happy to do that.
Perfect. Yeah, that's good. Any other questions, guys? Anybody else? We'll follow up with some information for those that need it. So appreciate that. Thank you, ladies, very much. I did want to say that Maggie's from Public Sector Consultants. I didn't say that at the beginning, and Sarah's from Michigan section of American Water Works. There, we got it out right. Association. So make sure we get our associations correct and everybody gets credit. So thank you, ladies. And we will have Jasmine Carson and also Rick Solle, if you would come up if you're here with us. We can have you both testify. Maybe Rick's not here. Got it. Perfect. Then we'll have Miss Jasmine give us a conversation. Thank you. You can start when you're ready.
Good afternoon, everyone. Thank you for having me here. My name is Jasmine Carson. I'm the Executive Director over Empowerment and Integration at Wayne Metropolitan Community Action Agency, or we're also known as Wayne Metro. We are one of Michigan's largest anti-poverty organizations with a primary service footprint in Wayne County. And again, we just want to kind of emphasize the need of water within our communities. It has been our #1 request as of this year of households that are facing crisis. And these are often working families that may experience like a minor setback. So illness, a family loss, or a job loss. When the water bill goes unpaid, the consequences escalate quickly and it turns it into a public health risk and a risk of housing stability. These assistance programs are designed to intervene early and efficiently. They provide timely, targeted support that prevents far more costly outcomes, both for families and our systems. Our organization alone, since 2022, has administered $59.5 million in assistance, reaching over 36,000 households across Michigan. These resources were developed quickly with rigorous compliance and oversight in place. We have proven both responsive and responsible, meeting immediate needs while maintaining strong accountability. Although our core work is in Wayne County, we've had the opportunity to service communities outside of Wayne County that include Almer, Port Huron, Clifford, East Point, Beulah, Marine City, Oak Park, St. Clair Shores, South Lyon, Lake Odessa, and Van Buren Township. So water affordability is not just an urban concern, but it's a statewide challenge. We've also seen a significant increase across outside of Out County, like areas like Taylor, Dearborn Heights, Dearborn, and Westland. In just 2 years, enrollments in these communities rose from 2,400 to 6,100 in 2024. This year alone, we delivered over $4 million to these specific communities. These programs are not handouts. They are essential public investments. They protect public health, reduce emergency costs, and help families stay housed, healthy, and financially stable. We respectfully urge the community to continue, where possible, increase appropriations for water affordability programs. The need is growing, the results are measurable, and the impact is everlasting. And to answer your question, we are one of those organizations that MDHS disperses the funds to allocate across the state.
Thank you. Yes, Vice Chair Edwards.
Thank you. So what will happen if you do not get those funds, though?
So what we try to do is work with the municipalities and create some type of plan or assistance individually. So we'll work with the providers, and we'll also work with the residents to provide wraparound services to decrease some of their costs in other areas to support for water as well.
So you would decrease costs in other areas to help them afford the water?
Correct.
And like what areas are you talking about?
So like we have the Michigan Energy Assistance Program. We can help enroll them in those type of programs. Again, we'll work with the utility provider or water provider and work out a payment plan internally with that specific municipality.
So if there isn't money, I'm sorry, Shara. If there is not money for that program or the water program, what happens to those families?
they're in a water crisis. They will be at risk of, health risk and housing stability.
Thank you.
Yeah, I guess so DHHS really didn't want to participate today, not blasting them, but they didn't know how to handle that, I guess. So I need to have somebody like you tell me how has that worked through MDHHS. Have you found it very working with like energy assistance? Do you find that works well?
Yeah, we have a really good relationship with MDHS. It does work really well, and I think if it continues, we'll continue to have a great relationship there.
Okay, and this water affordability would be similar.
Absolutely.
Go through the department. Do you know, like, we haven't got all the policies, so we got to work with the policy people too to make sure we know exactly what that's going to happen. And I will work with Senator Chang and make sure we get more information to the committee members so we know what that is. But generally, they do have a nice little thing here. They sent us a thing. So you do have a thing from MDHHS here. What last term, in this term, what I've heard there may be a difference is that more local municipalities have a little more say in what they were before. Like before, they wanted to get a bunch of communities together to work. I don't have a problem with that. We got maybe we can get a little more conversation.
Yeah.
I heard that there's more, like, let's say Traverse City decides to opt in and do this.
Correct.
Then the monies from there, hopefully go to DHHS, is going to come back to Traverse City,
Correct.
not to Alpena or the UP.
Right.
Is that what I'm understanding better?
My name's Deborah Pospich. I'm here with the stakeholder group, and I'm working with the Detroit Water and Sewerage Department. One of the major changes to the legislation from last session to this session is the money will stay within 4 MDHHS regions. And those regions are service center regions that are already in place. So the funds in each region stay in that region. The next change to the legislation is that the monthly fee was reduced to $1.25 and will go up 25 cents each year as if the need is still there to cover the cost of the program. That's for the fund. And then the third major change was the opt-out provision that you referred to. So a community can decide to opt out and just run their own program, and they will keep their $1.25 per meter charge within their water provider community. It doesn't go to the business service center to be shared with the other communities in that business service center. So, Traverse City may say, we're going to run our own program, administer the whole thing. We're going to keep our $1.25 per customer and use that to fund the program.
Thank you. That's
Okay.
what I'm that's what I heard was the change. Representative Longjohn, go ahead.
Thank you. Given that DHHS isn't...
Do your mic
Sorry.
so we can hear you.
Thank you. Given that DHHS isn't here, I'm sorry, I'm going to ask some public health questions. I hope you can answer. I assume that folks, households that are on water assistance programs as have been run, who are also receiving utility assistance, as you mentioned, that there's a significant portion of those families that are enrolled in Medicaid or other health insurance programs that we pay for as taxpayers. You've mentioned public health challenges when folks don't have water. Could you share what some of those you might have seen in working with clients and how taxpayers pay the bills at the end of the day if we don't provide these kinds of supports?
So again, when you don't have the basic necessities, you're at a risk of being homeless, essentially, or having those health issues. We have elderly clients. We have young children who have to bathe with bottles of water versus having running water or access to water. So it causes a much larger issue in the long run versus actually handling it up front.
And I could speak to issues I have seen in the city of Detroit with some of our customers who have been at risk of shut off or can't afford their water bill. They're not flushing. And interestingly, food stamps will pay for bottled water, but there's no help for running water. to flush a toilet, but you could buy a case of bottled water. There have been people who's have leaks that are just unbelievable, that are actually leaking around the toilet, and the toilet falls through the floor. So this program that will become through the legislation eventually has plumbing repairs built into the program administration. So it's to use water efficiently to help families get a bill that they can afford. So there's many public health issues to the issue of not having water, or having water with waste and leaks and things like that. And we're all paying for that, the wasted water. And I'd like to address Representative Edwards' earlier question about what happens if there's not an appropriation to tide us over until we can get legislation. Water providers have three options when someone doesn't pay their bill. They can put a tax lien on the house, they can shut the water off, or they can sue them. And for some families, none of those options will work, and the water provider is stuck, has an uncollectible customer there, and they have choices to make. And it's whether to use one of those three options, or that debt just keeps accruing, and they have to make some tough decisions when it's time for increasing rates the following year. Where does that bad debt go? Into the customer. You're creating a vicious cycle, because someone has to pay that bill. And for every % of collected water bills in Detroit, by way of example, that's $4 million of money that can go towards the infrastructure repairs and replacement costs. So, there's no money tree. They're the water providers, they're self-sufficient entities. What they collect is what they use to run the system. So I'll be quiet now.
Okay.
Any further questions?
Representative Beeson.
Thank you. I was listening to this whole. You are not providing water repairs for a rental house, correct? There should be no rental house getting your money when it's the landlord's responsibility to do that, right? There's not one time that you guys pay for a bill that is to fix plumbing. Yeah.
For example, there are local ordinances that require the landlords to have properly functioning plumbing systems and to reduce leaks. So you are correct.
Yeah, so you're not giving the money to a system that is a leaky system that's not owned by the individual ever. Like, there should be no money ever leaving your hands to any family where they're at, however they, to a rental house in the state of Michigan.
If the tenant is the one responsible for the bill and there's a leaky toilet, those funds could be used to replace the toilet.
But that's not. So we're actually. So what you're saying is, I like where this is going. You're saying that if you're a bad landlord, all you got to do is let people that don't qualify or figure out a way that have a bad situation where they can't afford it, and you're going to pay for them to fix their toilet. This system is broken.
Well,
Literally broken if you're doing that, and I can't support anything like that, because you're not holding the person that's accountable. You're fixing the system with our state money instead of the landlord. And the idea that you're helping them is all you're going to continue to do is open up a process where they figure out a way to continue to go down, and landlords can say, hey, bring these people in that I have been a landlord before, that I've got somebody to figure out a way to pay for the rent or pay for the bills, and guess what? The state's going to pay for my plumbing. Well, this is a scam all the way through. It should not happen for people in the state of Michigan. We shouldn't pay for any landlord. If the person doesn't own the property and we're not helping the person at the end, this doesn't make sense.
well, the program can be administered optionally to do that, but there's also, like I said, local ordinances that require, you have to enforce the local ordinances.
Bingo.
That's the answer.
Yes, it's not you guys coming in and saving.
Right.
And if there's money going out, and that's what I would like to see, that there's no money going out to any person that's renting a home for this function, because if you are, it doesn't make sense. Like, you're helping out a landlord and not helping out the person. I mean, otherwise, this is an opportunity that I would see if I was that landlord, to have a lot of houses and fix the situation that way.
Right, understood.
Vice Chair Edwards.
I'm so sorry.
No.
I just I guess my concern is that there is landlord-tenant rights, and then there's also families who are in need of services that something detrimental could happen if they don't have water. We're talking about paying kids who go to foster care. Now we're paying for them to be in foster care because they're removed from their home because they didn't have water. Like it's a vicious cycle, like you mentioned. So it doesn't just stop at the landlord is getting off free. No, the family still needs water. And sometimes, not all the time, water is not included in your rent or anything. So that person who lives in that home is responsible, right? Am I wrong?
Correct.
For that water bill, not the landlord. And there's also landlord tenants, right, where the person who lives in that home can take the landlord to court, right?
Correct.
Okay, thank you.
Any other questions? Representative, Vice Chair
Thank
Kelly.
you, Mr. Chair. What would be an affordable water bill?
So right now, for DWSD, we have if they're enrolled in a program, they can have a water bill anywhere between $18 a month to $56 a month. We find that based on the income level in southeastern Michigan, that is a good range for a water bill.
But they're in a program that pays for that.
Correct.
So in another handout is a $36 average monthly need.
Correct.
Is it a growing need?
It continues to be a growing need, absolutely.
So I sit here week after week and am told we're one of the poorest states in the nation. We're one of the poorest countries in the world, and I just don't buy it. I think that we've gotten ourselves to think that this is what we need to do. When you talk about things that go unused, that maintenance costs are deferred, blah, 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 that without these programs. Paying your bills does the same thing. And we keep increasing the poverty line, so more and more people qualify. I don't see an end to this. We're getting more, so we've got heat paid for, cable, everything's paid for. Medical paid for, rent's paid for, water's paid for. What should people be responsible for anymore for themselves? What's their entertainment dollars per month that they're spending? I'd love to know what a breakdown is on a family's budgets to see what the entertainment dollar is. And I bet it's more than $36 a month. I bet it runs into hundreds of dollars a month, even for the poorest families. They're still being entertained. They're paying for. I just don't know where this constant harangue of how poor we are, that the taxpayer has to keep assuming more and more of the cost of our fellow citizens, is just absurd.
Representative Beeson.
Thank you for being here. My questions are, I'm from a landlord side and making sure that your house is up to code before you put somebody in there. And I know some areas that aren't like that. My second part of this question is, can you give me the data to make sure that every money that we give out are to U.S. citizens, that they're not to just low-income people that don't belong here? That's my concern, is us taxpayers. I mean, that's something that I ask all over and over. Who are we helping? And, I mean, if they're born here, and that's something that's really concerned, but at some point in time, those dollars are getting eaten up, and that's all I want to know. So everybody that you guys have helped out are born United States citizens? Do you know that question?
I don't have that information on hand, but we do ask for their residency. So as far as we know, everyone that we've served is.
So you can give me the information that shows me that everybody that applied has a U.S. residency for your program. That'd be great.
Okay.
Representative Longjohn.
Again, appreciate you being here. I'm wondering if, kind of building on my previous question, folks who are enrolled in Medicaid, we have a stake in their health care. We know as taxpayers we're paying at the end of the day if they show up in an emergency department because of an infectious disease or their child's dehydration. because of diarrhea or other things that go along with lack of having access to water or ability to afford hygiene and cleanliness in the home. So, we know we're going to pay if they end up in the emergency room. Instead of thinking about where does it end in terms of assistance for families, the question is what's preventable. If families have access to water and are less prone to diarrheal diseases or bacterial or viral illnesses, do you think that that's part of what helps this be a cost-effective policy, that it keeps people from having low-value care downstream?
Yes, I would say so. Water is a basic necessity. We're not talking about something that is just a want. This is a need for survival. So, absolutely.
Thank you, Chair.
Representative Desana.
Dovetailing off of Rep. Kelly's comments, I have no doubt that people struggle to afford water. I have no doubt about that. We don't drink our tap water in our house. We have city water. We don't drink the tap water. So we pay more money to get filtered water to filter out a lot of the things that are in your tap water. Tap water can be good for some things. I'm not sure it's so great for drinking. What I will say is that when you look at anything in a vacuum and you don't have context, it's easy to say this is not affordable. And I look at what government does and how much we charge people in property taxes. If their property taxes were lower, water would be much more affordable. What's more important? I agree with you. Water is a basic necessity. If you don't have water in your household, you're going to go to the river like our ancestors did and get it, right? And that's not practical for many people today. I live in an area where we paid for the water system, the pipes to be extended, and there was grant money that was a match for that, right? So we paid for the infrastructure. So government does subsidize water. We do. However, we've got a gigantic area, Wayne County, Detroit, that has the infrastructure for water, and we're not encouraging people to live there because of the cost of living there. So I think we've got to look at the whole context here. Water would be more affordable if people owned their property, right? If they own their property and we're not beholden to the government for all of these other expenses. And yes, some of the taxes go to things that we think we need or we think we want, but it'd be hard to have a household without water. I would agree with you. Thank you for coming today.
Timmy. Representative Beeson.
I agree, but my concern is foodborne illnesses do happen, and I'm a butcher because of few people didn't wash their hands. Like 85%, like Long John says, 85% the reason why you get sick is because you didn't wash your hands, or your person that worked on your facility or worked on your food did not wash your hands. So I agree that we need the water, and I think it's a great across the entire state. I just believe that the people that are here paying taxes, like you folks, it goes to the people that are here, living here, that are supposed to be here. That's only my concern is.
Hold your... Well, we thank you very much, ladies, for coming today. We appreciate the vibrant discussion from everyone and look forward to seeing more information come through to us. And I really appreciate your time today, and enjoy the rest of your day. Thank you. I do have a card to read in. Cindy Roper, Natural Resources Defense Fund, is supporting whatever we get to. And of course, Wayne Metropolitan Community Action Agency, we're here, and thank you for presenting. We have information from you. Water Resources Commissioner Jim Nash brought us some information. Just want to make sure everybody knows that. American Water Works Association, Michigan section, gave us information we can study here. United Way, Southeastern Michigan, gave us some information supporting of the legislation. And MDHH did give us a sheet on information. So thank you all. I appreciate it. All members are accounted for today. So no further business before the appropriations. I'm sorry? Yes. Yes, we did. You weren't here for that. Yeah, you were. You were here. Yeah. Timmy did it today. No more information or business before the House Appropriations Subcommittee on Human Services. We are adjourned.